I'm Dr. Bruce Dorr, and
Dr. David
Dr.
Watson.
David Watson is the
He
deal.
didn't remember my name.
I forget. Huh? What? It's only been 21 years, something like that. Anyway, for those who don't know us or what we're all about, we were and still are, I guess, general OBGYNs. We are not.
GYNs.
Now we are GYNs, specifically is the deal, so stopped delivering babies last year. I went kind of one step further and grandfathered into a subspecialty of OBGYN called FPMRS, Female Pelvic Medicine and Reconstructive Surgery. So that kind of led to a few other things that have helped related to incontinence and other women's issues. Throughout a lot of our career, we've seen things that have happened to our patients that have been distressing, both from your standpoint and our standpoint, as far as good, safe, effective treatments, rather than just surgical options. Things that our business is or was great. Things surrounding pregnancy, that was a great business for us, and now taking care of the aftermath of what babies do to their mothers is another kind of evergreen, blooming business. And as we saw some of these other offshoots start developing that was somewhat distressing to our patients. We had patients that were going and seeking kind of cosmetic care for things that happened after delivery. We had women that would go out and they went to Dr. 90210. They were spending, $10,000, $20,000 on kind of cosmetic procedures that were going on, and we would look at them, say, after a few months after their surgery, and we're like, well, we could have done a better job than that, is the deal, at a lot less price, and it used to be and was covered under insurance. But as people started seeking this out, the insurance companies caught on board and said, wait a minute, what they were doing previously, and we covered it or paid for it, now it's cosmetic. Stop covering that across the board, even though people were still having legitimate medical problems, whether or not that was painful intercourse or problems in the way things came together after deliveries. And so there was this other kind of med spa mentality that started for women that initially was somewhat cosmetic and then started developing some medical legitimacy. It wasn't until, and we kind of shied away from that because of that kind of, superficial or not legitimate medicine side. And we went and started seeing more and more develop, and we went to a lecture that all of a sudden we started to see real medical data on improvements in incontinence, and that women were getting these procedures done by plastic surgeons. And if that plastic surgeon started thinking like a gynecologist, these women, for the same price and basically the same procedure, could have been cured of their urgency, of their frequency, of their stress incontinence, rather than just looking at how it was looking, is the deal that way too. So that's when we started to get on board with Votiva, or what you're here for tonight. So Votiva is kind of another stage or another step of the process of a non-invasive way to help with a number of different problems that can happen either as a result of childbirth, as a result of medicines, as a result of menopause, as a result of change in hormones. As another offshoot, as we started to grow and develop the hormonal side of our practice with our pelleted therapy and bioidenticals, it also led to women, Dr. Dorr, I'm having a lot more sex and it hurts, is the deal. How can you help me on this? And so it's also led us down this road for this type of procedure. So Votiva and the procedure that we're talking about, or vaginal, it's under vaginal rejuvenation, but we're trying to coin the term vaginal restoration. So restoring, whether or not that's helping, in addition to hormonal therapy, or whether or not that's helping from that physical side of things, that's what it's all about. So vaginal rejuvenation, this is a procedure that's done in the office, and ours is non-invasive, but the original ones were meant to help restructure that skin and that support in the areas out in the vagina as well as outside the vagina, because of concerns that happen either with how God put you together or with how things came together after deliveries, after previous surgeries that just didn't either function correctly or were uncomfortable. And so the original procedures used lasers, so CO2 lasers that can actually burn. So these are things like if you go to the dermatologist or the plastic surgeons, they go in and they actually, where they remove warts. So these are lasers that vaporize the skin. And so people will do this of their face. They'll get CO2 resurfacing or lasering the face. And that's been going on for skin or cosmetic procedures. And so what they did was trying to get at restructuring and helping with the skin in and around the vagina. They would go in, and they still do. It's under the name Mona Lisa, uses the CO2 laser technique. But they go in with a probe that actually makes holes in the vagina. These are a series of cuts that, just like if they do that on the face to try and regrow and restructure that collagen and for wrinkles and things like that, this goes in and tries to restructure the glands for vaginal lubrication and to help that skin kind of regrow and restructure. So it's all about making that kind of initial insult that will regrow and better collagen and reformation of that. And what they've done, and other laser companies have gone on board. So you see all these laser things from med spas and from dermatologists and things like that, like I said, for skin and the face. Well, they're all trying to get at trying to restore that more youthful appearance to the face and neck. Well, they're trying to do it for the vagina. And this next set, rather than using these iridium lasers and things that make cuts or holes in the vagina, the type that we have now uses radio frequency. And radio frequency is an energy that, just like you can use an energy that goes through the walls of your house and around that gets to your TV, this goes through the wall of the vagina, or the skin of the vagina, that gets deeper to that collagen layer that helps give you support. Underneath the bladder, to the lower part of the rectum, to the skin near the outside of the vagina. And this goes 4 times deeper than what the original ones were doing with a CO2 laser or the Cyton laser or the iridium lasers. So it's just been a kind of the next step. Now we don't make those holes or cuts in the vagina, and we can go deeper to these lasers. And so it tends to be, one, more comfortable. It's a less invasive procedure, so you don't have like 1-2+ weeks of healing, of bleeding, of vaginal discharge as that skin is remodeling and reforming. And all that discharge can lead to infection and things like that that can go on that way too. So again, this is non-invasive. The probe looks kind of like an ultrasound probe that delivers that energy through that skin of the vagina that gets to those deeper layers, like I said, about 4 times deeper than that superficial layer. And in getting to those deeper layers, you're getting closer to where things run for the bladder, and again for the rectum, and for where that muscle starts developing. And now they have studies that are showing us that it increases muscle recruitment and the nerves that go to the muscle, that people are be able to better control the muscle of the bladder and the muscles in and outside that help give support to the pelvic organs is the deal that way too. I know I'm doing a lot of talking. And this is meant to be informal, so informative as well as, to answer, a lot of your questions is the deal about this that way too. So in addition, so that is the next step with the radio frequency. Ours is yet one more step on top of that they call it bipolar rather than monopolar energy. And what that is that it's less time. So the original radio frequency energy that's been out for a little over 3 years now, and they have data on it showing improvements with urgency and stress or leaking as you cough or sneeze type of incontinence. That those procedures took about 30 to 40 minutes. This is now down to about a 20-minute procedure. So it's faster and just as effective without making the holes or cuts in the vagina for risk of infection, and comfort for the procedure itself is the deal that way too.
I do think that's the difference between rejuvenation and restoration too, is that rejuvenation was really intended for vaginal atrophy and things like that, significant vaginal dryness, for postmenopause. We see it in breast cancer patients, things like that, and it worked well for that. And I think they did create some rejuvenation, some new superficial improvement to the skin of the mucosa of the vagina, but it didn't do the deeper things. And I think that's the difference in restoration and rejuvenation, that we actually go deeper, restore the supportive layers to the bladder and the vagina and everything. I think that's why I think there's a difference between rejuvenation and restoration.
So we're getting to all of those layers. So rather than just that superficial skin, it's starting at that base skin that all kind of develops up. Is the thing with that. So other skin disorders, and there are many that can happen in and around the vagina. There's one called lichen sclerosus that makes for this kind of almost crepe paper skin that can bleed real easily. That can happen as a result of hormonal changes in the absence of hormones, or people are on different medicines, anti-estrogen type of medicines that can come from chemotherapy or from breast cancer that people get. So it helps in the face of a lot of different things. And the beauty of what I'm saying is that now it starts to fall into legitimate medical things that you can benefit from, but it also helps, one, without looks. I get people who come in, or after their delivery, they're like, Dr. Tour, it just doesn't look the same, and it's very distressing. Sometimes people will get divorced and they're like, I'm embarrassed to date. I'm embarrassed with how, I'm going to look to a new partner. And it shouldn't matter, but it matters to a lot of people. So it improves that appearance of all that, but it also improves that function. So again, like I said, thinking more like gynecologists, you get all that benefits, and that, yes, it will look better, and we'll see almost immediate before and after pictures that we see the changes or the benefit of how we'll have people who, after a vaginal delivery, the labia don't come together. And what happens is, when you have that opening or that gaping, that the muscle doesn't come together near the outside of the vagina, as you stand, that's what everything sits on. That's what your bladder sits on. That's what the rectum sits on. And so when you have an opening in the bottom of that stays permanently open, or is very weak like that, then all the pelvic organs try to come through that opening. So as you cough, as you go on the trampoline, as you jump, as you run, as you do all that, that's all trying to come through. And the weaker that is, the more likely you need us for something much more significant as far as that reconstructive surgery, that sometimes not even native tissue, that we have to go to things like mesh, and you hear about all the complications that can come surrounding when you lose that skin and that support is the deal that goes on. So we kind of look at that full picture, and we look at that hormonal picture as well as that structural picture. And this type of procedure is now FDA cleared for stress incontinence. It's about a 75% improvement, and so it's not 100%. And there are some kids that have beaten you up so bad you need surgery. There's just no way around it. But do people get to the point where, yeah, I don't have to wear a pad when I go skiing? you know. Now I can do a squat and I don't leak anymore, you know. So, but again, you get those severe episodes of the flu or something like that. Yeah, you're probably still going to leak a little bit more. And the beauty is, if you are marching towards something that is needed like that, the tissue that we get to be able to operate on, if you ultimately needed or wanted or chose that surgery, you have better skin, better collagen, that your surgery is going to be long-term better successful if you went forward with something like this first. And so I really feel like there's this, you can do many things conservatively, you can always have surgery. All these things are going to improve your chance or success of those being more successful for you. But in addition to that FDA clearance for stress urinary incontinence, it has the indication for female sexual dysfunction. So in getting to these basal collagen layers, that's where the nerves run. That's where the blood flow runs. So if we can't get at it hormonally, or say with a physical therapy specialist or whatever, this helps with the nerves and the sensation and the blood flow, that people feel like intercourse is better, that people feel like orgasm is better that way too. It narrows or tightens the vagina, that people feel like.
And you've had really good success with retracting those.
So there are people, and I'll do consults on teenagers that are plagued by one labia or near the outside of the vagina is longer than the other, and they're uncomfortable with how they look in a bathing suit, or later on uncomfortable with intercourse. Or after a baby, they feel like that just is, it's too large, or they grew. Now we'll see some shrinkage or retraction with that when we get better support of that underlying collagen, that we'll see shrinkage or restructuring of that if it's been hurt or developed in those areas. So we concentrate on one side or another that will help with that appearance, and then that function is a deal that way too. And yeah, we go down, and after we're done with the vaginal portion, I had a lady this morning that we did, and basically by the end of it, her hemorrhoid was gone. And so that's all just basically a dilated blood vessel, so in thickening and resupporting that skin around it, it's gone. So for very small, for the bigger ones, you probably need something a little bit more. With this technology is another type of procedure that you can have done called a fractura. Fractura starts to get invasive. And if you have seen or know in the cosmetic or dermatology world something called microneedling, what they do is they take a pen that they go in and they make very small holes. And this is getting towards that other side where they started to make holes and restructure the vagina that way. This is not for the vagina, but it's for the skin and support near the outside of the vagina. This uses, it looks like a little stamp, that very small needles go in, and then it delivers the radio frequency energy for it. So you have to be numb for that, is the deal. So we put on a numbing medicine, but it's even better as far as retracting and restructuring that skin. So we've had women who have had these procedures that are scarring. They are deforming. We had a lady who went and she basically got what they call a mini vulvectomy. So the surgeon had gone in and took away a lot of the skin, and so she ended up with big scars near the outside of the vagina. And sometimes that can happen even after traditional repairs, or certainly after deliveries. And so in getting at that scar tissue, this goes in and delivers that energy, structuring from both the top down and then also the bottom up is the deal for that full thickness skin type of repair. So for instance, in scarring, or for other potentially even pain issues that are going on, for problems with, say, larger labia that are uncomfortable during intercourse, we can go to something like that, or that type of technology. And they gave us the probe that works on face and neck, and so we're looking at each other like, okay, what are we, is the deal, as this technology starts to go, that we're looking at expanding into those areas, but obviously our area is the deal, as far as where we're trying to concentrate what we do. But as we go over to that, is it like, a mini facelift or this micro needling that some people will get at certain offices? Yes, we can and have that technology, and this technology works, for skin all over your body. So like Dr. Watson was mentioning for hemorrhoids, does it work in stretch mark areas? It does. So it supports and restructures that skin. So the appearance of that goes away or gets better also.
Can you create a whole body scan?
Yeah, wouldn't that be nice?
Do all with me.
Well, one big laser scan is the deal. You feel like that. Unfortunately, after a while, it's not fair. Is the deal.
I do have a question.
Sure.
So you're talking about this procedure now. Is it a one time it either works or it doesn't, or you do it multiple times based on how many symptoms you're addressing? What?
Right. Yeah, so it's recommended that you have 3 treatments about 4 to 6 weeks apart. Officially from the manufacturer, they say 2 to 4 weeks. But when you look at skin and cell turnover, it's about 2 months. When we do one treatment, we recruit and remodel anywhere between 10 to 15% of that collagen in that area. So 3 successive treatments, you're getting about, at least 50% of that way too. Now our collagen ages. Whether or not that is, of the face and neck, it ages all over our body. So could you need another treatment, like say in a year? Yes, that's possible. But I have people that are doing squats dry after one treatment. I have some people who are like, Dr. Dry, I didn't really get a whole lot from that first treatment. And then they really notice it from the second one. And there are some people who don't feel it immediately. We'll show them before and after pictures as we do the procedure. We show before and after pictures, and everybody's like, wow, is that me? Because, the lady today, she goes, that's what I look like before my kids. And so it looked like I did a repair, on her. And I have some people that I've shown in the office, this is what it looks like. And I never thought this was going to be ours or, my direction. I always thought it was going to have to be a traditional repair that I was offering, and I see what this technology does, and it's pretty exciting, for a 20-minute procedure. So for the patients that I know and that I'm doing the procedure, or as we initially started out, Linda that was doing our procedures, knowing that their concern was more urgency. Incontinence, or that theirs was more that they hurt right here, in some certain area, or that they had more stress incontinence. You start to, rather than the 20-minute procedure, I spend an extra 5 minutes right underneath that urethra, because that re-supports. So how incontinence works is that urethra moves with a cough or sneeze. So if you have better support, whether or not that's collagen, or whether or not I surgically put a sling in there or something like that, it's just getting that urethra to quit moving, and that's what kids do, is they ruin that support of that bladder neck. And so it's just getting at that. So concentrating in that area and redeveloping that tissue, that's what it's all about. And I hate to, the poor lady that had a procedure today, I'm talking all about her, obviously it's anonymous, but, I knew right away. I said, your baby was facing down over this way, weren't they? And she goes, yeah, how did you know that? Because as I was doing the procedure, she had lost almost all the support out over to the lower right side of the vagina. The other side was fine. And so in concentrating in that area and restructuring or help re-supporting that area will make the difference as far as how that she's able to do a Kegel, and I concentrated on that area and knowing, just as a gynecologist, how I would repair that surgically. Well, I'm kind of doing the same thing with the Votiva wand, is what it's all about. So it's tailored based on, what's going on for you is the deal. Yeah?
How long is the recovery with this?
We say 2 days, no hot tubs and no vaginal intercourse, but it's non-invasive. So you can be biking in Moab basically in the next day, but just nothing vaginally that could irritate you vaginally.
How long does it actually last?
Is it like, you go 6 months and you do 6 months and you don't exercise your Kegels, you're going to lose whatever you did you want.
Right, right. So that's the question. So, after a facelift, how long does that last? After our surgeries, how long does that last? So the problem is, as we look at, say, medical studies, the longest studies that are out there usually will only get 5-year studies and or 10-year studies because people move or they don't answer their phone or they don't answer their mail. So we don't know what that follow-up is. This degree of this rate, so radio frequency has been out for about 3 years. So most people are good, and again with that turnover, the more maintenance that you can do, say after the procedure, whether or not that's with Kegel exercises, maintaining good health, whether or not that is your nutritional health or your hormone health. Those are all factors in how well you're going to keep that structure or support. We're not putting in a mesh that will not necessarily age or something like that that's going on. So again, the manufacturer says that people will need say a retreatment in about a year. In talking with a urogynecologist that had talked to us before, she said, most people are lasting, but, she had only been using hers for a little over a year too. So the jury's a little bit out from that standpoint, but the most you can do after that to maintain your health is going to be the key to that way too. The people that keep up with their Kegels say after, even if I do a surgery, yeah, they don't need me later on is the thing for that. Yeah.
I've been using radio frequency on my face for 20 years since I was like 40 and I'm 61 monthly.
Awesome.
So, I never thought about using it internally though.
Right. So, yeah, that's the next step. I don't know about any radio frequency over the counter, things that you can use, but the radio frequency, that we have or use for the face. So the same wand that we use vaginally and near the and for the outside of the vagina, you can certainly use on the neck. But as far as its effectiveness for the face, not as great. So that's why they recommend that Fractora, that and more invasive, because
Well, I
most
got the
people.
face covered, but the neck, you didn't get it. It's noticeable now. I'm looking and going, can we all work?
Yeah.
Right, right. So the Forma-V that we use for the vagina can definitely be used in the neck. And I was hoping to have these before and after pictures tonight.
And breast tissue.
What's that?
Breast tissue.
Well, they are using that in different areas, more for stretch marks than anything that way. So that definitely lends or gives to support is the deal. Yeah.
So when you say, like, you can certainly have surgery, or you can certainly say that, does that mean that it does or does not work for everybody, or depends on the level of damage that they're already addressing? What does that mean exactly? Like, is there a chance you can go through this and it's not going to have an impact?
There's always that risk. So, sometimes, again, I had my one lady that, I delivered her 12th baby on, and I'm like, okay, this probably is not the procedure for you. You probably need surgery is the deal. So yeah, 30% of, classically, 30% of women after one vaginal delivery need some type of vaginal corrective surgery. That goes up about 6% per delivery after that, and another 6% for each pound above 8 pounds is the deal. So you start getting into this, you run a high risk of needing surgery.
So
But does it help with that?
When
It can.
you are making a decision on a per patient basis, you do like obviously some kind of a physical or something to say, yes, you're a good candidate, or no, you're not,
Yeah.
like that.
Yeah, so, majority of you, I recognize that, you're our patients, so, we've gone through that exam, and for many people, I do a consult, and I sit down, and we look at that and say, so for mild prolapse, for in general mild stress incontinence, it's improved. But I see people that have gone from wearing pads to being dry the next day.
So it's just a matter of some people it takes and some people it doesn't.
Well, and you see people who, you know, have been to the dermatologist, or, you know, they go on retinoid products or things like that, and, you know, those before and after pictures where you think, oh, I want that. But, you know, results may vary.
Yeah.
So, you know, you look at that, and we hope for that, you know, and everybody wants that easy recovery, no risk, good benefit. And so the beauty of this is that it's arming us with ways that we've never had before that can help you without going through surgery. And, you know, for the people that can't do hormones without taking hormones or things that, you know, are contraindicated for your health for whatever reason. So there are some, there's going to be somebody who doesn't respond, you know, but a majority of our people have some benefit, you know, like I said, whether or not that's bladder, whether or not that's sexual function or things like that, it helps in a number of different areas. Yeah.
So I have a two-part question. First thing is, you're saying it's fairly new, 3 years or so. So I'm just wondering if there's any research that shows any correlation with cancer or any bad side effects that we should be aware of before we make our decision.
Well, you know, this is very similar technology as far as what they're getting at that's been out, you know, even over the counter for, you know, 20 plus years. So really we don't see that coming. And I think there's many things in medicine that we don't necessarily see coming, so I can't say, you can never say never and always. And so, but as far as, you know, with what we're doing or the superficial treatment that this is overall, and the type of energy that it is, it should not be a risk or a problem.
So there's no documentation at this point of negative type things?
No.
Okay. Thank you.
Yeah.
Does age make a difference?
Age does not make a difference. Yeah. So it's all depends on how that skin is gonna you know, respond. And so to have things, and that's why, you know, we kind of look at our patients for from a number of different standpoints, but having things hormonally right. So estrogen and certainly you know, testosterone, the pelleted therapy that we do, that affects the skin. You know, whether or not that's the skin of the vagina, you know, or whether or not that's skin all over your body, that certainly can make a difference too.
So it's kind of skin age rather than just age in years. Because someone who's young and has poor hormonal support and things like that may not have as healthy of tissue as somebody who's older and has good hormonal support. So they may do better. Yes?
Yeah.
Now, the restoration then would be better to have it internally, not just, it's more aesthetic for external, and then the microneedling is external and internal?
No internal on the microneedling. That is only external for skin. And so we recommend, you know, just trying the non-invasive in general, that it's called a Forma-V, and see where you get or see how things go for that. And you don't have to be numbed. You know, you don't run the risk of making those holes or risk of infection or things like that going on. But for pretty large hemorrhoids,
That builds the strength with just
the Forma-V does, the Fractura does. It's doing from that top down as well as from that bottom up, and so it's definitely a little bit more of a procedure for people who need more of that. I think it's a pretty legitimate procedure. So it's just going to restructure that skin a little bit more than just what the Forma-V is, but it is invasive and it's definitely more uncomfortable. But not, the Forma-V, the non-invasive one, is the only one that we do inside the vagina. So these other ones, the Cyton laser, which is iridium, the Mona Lisa, the CO2 laser, it's a probe actually that goes in the vagina, and then there's these kind of rotating holes that laser cuts through circumferentially around. So it looks like a corkscrew that comes out, but it's making these holes laser-wise all the way through is the deal as it goes around. Between 5 5 to 10 minutes. It's not forever, but
Okay.
it's invasive and it's uncomfortable.
Okay, but then the microneedling is only for the outside.
Face and neck and the outside of the vagina.
Okay.
How uncomfortable is the non-invasive procedure?
Most people have, it's like a sensation of heat. We ideally like to get the temperature between 43 degrees Celsius, so that is roughly a little over 100 to about 102 degrees. And so for the people that are uncomfortable, Linda, have you had anybody that we've ever
No one
gone?
has ever not been able to tolerate the highest temperature.
Nobody
Right.
went into a hot flash.
Well, maybe they got into a hot flush, but not eventually is the deal
They
that
did,
way.
they didn't tell me.
So, and again, the beauty of this, they call it a thermal resistor, but it senses if it's getting too hot, it could burn. And so on the probe, which the original radio frequency devices didn't have, it shuts off. So if it starts getting too hot, we'll hear it's a special ring that starts going on as we're doing this. It will not go hotter than that highest setting that we have. The ideal temperature range for remodeling and restructuring of the collagen in that skin is between about 40 to 43 degrees, but it will shut off at 43 degrees. So if you're consistently at that level, it stops heating the probe. And so you stay at that, and then it starts cooling down. And the reason why it stays cool is that we keep moving. So with the probe, it's a kind of in and out or side to side type of motion that we do for that way too. But again, that's what most people feel is like just the sensation of heat. And some people, as they're doing it, they feel like the probe, I know it sounds funny, but the probe is getting bigger, but actually the skin of the vagina and that collagen, it's getting tighter around the probe, and so that's what we've heard feedback from some patients. They feel it changes that way is the deal. But we can always turn down, if you're uncomfortable, we can always turn down that setting.
Thank you.
And still get the effect, yeah. Hot flushes, yeah, those are unpredictable. Anything else? Any other questions or concerns? Yeah.
Is insurance covering some since it's a viable medical procedure now then, or not yet? Not yet.
Just like our pellets, it's the bane of our existence,
So
is the
not
deal.
yet.
So
Okay.
insurance companies don't make sense, but they make money, is the thing. So if there's a hint of what do I say, cosmetic to anything, they shut that down.
Right.
And things that, like I was saying, that we legitimately did and got paid for and insurance covered, now they're not covering because people are willing to pay for out of pocket on those things. Now, the legitimacy of how this is working for bladders and stress incontinence, that is a multi-billion-dollar fee on insurance companies. So if they could do this and somehow regulate that, I don't know. There may be somebody that starts looking at that. And as we get more and more numbers, so the initial studies on incontinence and that, they're all smaller studies right now, but there's a multi-center trial going on now with radio frequency, so it'll be interesting to see where this ultimately goes. But that the original thing is more, and again, getting insurance companies to cover for women's sexual health is, shouting in the dark. It is very difficult, unfortunately. What's that? Need some new lobbyists is the deal. Yes. So it remains to be seen. We'd like to think eventually that someday they'll cover more legitimate pellets rather than the fly-by-night kind of pellets that are out there that way too. So, all right. Other questions or concerns or?
Do you guys, are you the only ones that do this procedure now, or do their PAs do it?
Yeah, so we all know how to do it. In general, we do have a new nurse practitioner that's starting with us that will be doing them. Linda, come on. So Linda's been doing them. She will be doing some, and we, until we have somebody trained effectively, are doing them also that way too. So it's kind of a mix of us. It kind of depends when you're scheduling.
She's doing them and she's not trained?
No, she's,
No, Linda's very trained, isn't she?
Most trained.
Yeah, she is the most trained and most experienced of
Most
us
experienced,
that
yeah.
way too.
So you're doing the majority of them now? is
I
that-
am now, but I will be doing less because I'm gonna be working somewhere else.
After
After
25
25 years, Linda's doing. She misses her babies. Is the deal.
I was the
so.
ultrasonographer here for 25 years, and so I'm going somewhere to do some ultrasound as well. But I'm gonna be here 1 day a week and doing the ultrasound, and then if there's ever a Votiva that happens to land on a Thursday, then, you know, I'm happy to do that as well. But,
There you go.
but our people they all went through the training together. All the providers went through the training together, so. And I'm gonna get them all up to speed before I go.
Yeah.
How many have you done so far, and what is the success rate?
That's a great question. I bet you we've done about 30, maybe,
Least.
including our employees.
Well, and luckily some of our biggest success stories are our
Oh my
employees,
gosh,
is the
it's
deal.
been crazy how happy they've been. And I would say, gosh, nothing, absolutely zero negative comments. Maybe some people were expecting greater results on the first treatment, and it wasn't quite as great as they thought. But most people came back and said, I can't believe this. This is really awesome, especially.
We had, I can think of one disappointed lady because her friend was cured of her incontinence after one treatment, and she wasn't. And so she's been calling us saying that, it's still there. And so the problem is, everybody's different.
Right.
And the recommendation is 3 successive treatments. Do we have people that are successful after 1? We do. Some people need the 3, and then it's still not quite enough because of that damage, because of how that skin responds. Everybody's going to be a little bit different. So yeah, the results may vary, is the thing. But I don't know that anybody has had no response.
I don't think so.
I think everybody's seen some improvement in those areas.
And
Is
it's
it to the
funny,
degree
when
that-
I show them the before and after picture there, it's like, oh, wow.
How many of us know what we look like?
Which is kind of hilarious to begin with, because it's like, do I really want to look at this? And I'm like, and I encourage them, because it's pretty, some of them are pretty dramatic. Some are not as much, but I've never seen any that didn't have any change. But
So are the before and afters in and out? Or
you can't see it
choose-
Yeah, just the
before
outside.
in, so it's just the outside.
Okay, so you don't.
Yeah, yeah. Before, but even when you're doing the treatment on the inside, a lot of times patients will say, did you put a different probe in, or what's going on? Why does it feel bigger? Because there's an immediate tightening response. So you feel the internal and you see the external.
I vote for the face and the neck and the home. Just saying.
One-stop shopping.
And then we've been practicing on the employees with that one too.
Yeah. See where we go with that.
So, yeah, hopefully we can offer it all at some point.
All right, yes.
You mentioned before about the mesh. So the mesh is something that's permanent and that is surgical versus this, which is really not necessarily permanent if the health is not maintained.
Right. So now it still is a legitimate surgery in the right patient. The problem was vaginal mesh. So for supporting or re-support of, say, bladders that had dropped or rectums that were like trying to pooch out of the vagina, rectocele or cystocele is what they call it. Some people's own natural tissue wasn't good enough to restore normal support. So what we were doing for a while is you would make incisions in the vagina and you would put this woven suture material, is what mesh is. And that was the scaffolding to give the support. Well, the problem is in doing those type of procedures, about 20% of women would have it erode into the bladder, erode into the rectum, into the bowel, or come back out through the vagina. And 20% is a high number when you think of a complication rate. We never did it.
Unacceptable. Yeah.
We never did it. We're like, why would we put our patients through that? But urologists, or the surgeons who that's all they did, so people would come and they would go, they'd get their surgery and they go, we see people for their lives. And so we didn't want that happening to our patients is the deal, because now we got to take it out of people is the problem. And so in the right patient, is mesh still a legitimate thing? It is, but placing it abdominally. So we do those type of surgeries usually robotically in the right patient. So there's mesh that can go on either side of the vagina and bring it up, but that risk of erosion goes to less than 1%. So that is pretty low. Slings, or specifically for incontinence, so leaking as you cough or sneeze, that also carries a less than 1% erosion rate, or exposure, meaning that the mesh is exposed through the skin of the vagina. That just helps refirm that bladder neck, and that is about a 20-minute, 30-minute surgery that we do. And so, yeah, you're trampoline dry after that surgery, but it's anesthesia, it's surgical risk. And the other risk is that I can make everybody dry, I can't make everybody pee. So you can overcorrect. That is the deal. So there are some people who have to put a catheter in after their surgery to completely empty their bladder. You don't get that with this type of procedure. So there's not this risk of overcorrecting. Is there a risk of a non-response or an undercorrection that you are dry? That's the risk of a non-invasive procedure. Does that answer your question, or
Yes.
too much? Okay. Yeah.
What are the drawbacks, the complications, you mentioned with the original procedures, there's always the risk of infection because it's invasive, this isn't. So what are the drawbacks other than results may vary?
Yeah, so we always worry about that potential non-response. So just swelling is the biggest thing, a little bit of discharge. There are some people who are getting this, and we've had success, people that have just gotten recurrent vaginal infections over and over again, because the skin of the vagina just wasn't good to maintain that normal pH, the normal bacteria that help prevent infection. So, we've seen success as that skin starts to become more normal to support the normal bacteria, going for less infection. But there's always a risk of infection. As we heat or do that procedure with the gel and things like that, there's a risk of a vaginal infection that can go on. But just the sensation of heat, warmth, swelling. Some people may get just a little bit of spotting. What's that?
Yeah.
Redness.
In fact, what we're doing now is putting gel inside the vagina, especially if they have a dryness issue, before we start. Because a couple of patients, at first, we were just doing it without, and it would cause a little bit of bleeding, so a little bit of spotting. So now we're...
Is there any difference between somebody who's had a hysterectomy versus not?
No.
One has a uterus and the other one doesn't.
You can't fool him.
That's why I come to you, because you're so damn smart. At least that's what your badge says.
That's right. Uh-huh.
So I'm gonna ask a magical question, what's it cost?
What's it cost? So per treatment, if you wanted to do a single treatment, it's $1,200.
Okay.
So for a package of 3, it's $1,000 a piece, or $3,000. Tonight we have a raffle for a significant amount off. Is the thing, and then yearly. We haven't gotten to that year part. What's that? $750 if you wanted to get it, say, in a year. Say if you wanted to get another treatment or feel like you needed another treatment.
And
Yeah,
we
tune up in a
recommend
year is
3
the deal.
to get the maximum benefit.
And how far apart?
4 to 6 weeks.
So you have to look at, say if you were considering surgery, whether or not that's surgical restoration to the vagina, or whether or not you're looking for stress incontinence. You look at what deductibles are. You look at what your hospital fees would be. You look at what an anesthesiologist would be. You look at the results and the recovery. So, You can do normal activities, again, not in a course just for that couple days like we said, but you can do normal activities. You can go back to work even that day, rather than a 6-week healing time. Some people have prolonged healing if they had a scar, or if they had infection or things like that going on. It's a similar recovery from hysterectomy. So that's what the surgical restorer support is. So yeah.
How effective is it if you have to use gel? Does
If-
gel hinder?
If you have to use gel, what do you mean?
She was saying that with some people
Oh,
with
if you're really
dryness.
dry?
Yes.
Yeah.
Yeah, we use that on everybody.
Oh, okay.
So we use the gel. So it's kind of like, you know, the gel as you got, say, a vaginal ultrasound, like during
Okay.
pregnancy. So it's that kind of gel. So we use that. It's a conducting gel. And we have to have that conduction because it's a metal probe that delivers that radio frequency energy. So it's that's how it
Couples.
conducts through the...
It couples the skin to
Yeah.
the probe.
For those of us who don't want something dry jammed.
Right, yes.
But that's one of the indications to do it, though, is vaginal
Yeah, no, I
dryness.
realize
Exactly.
that, but I'm just saying, if it required dryness, then some of us wouldn't be going there.
Right. Good. Now, Linda, are you in charge of the raffle, or?
I am, but
Okay.
maybe Cheryl can draw. So,
Jeannie should